All right. Good afternoon, everybody. Oh, hold on one second. Not ready for me yet. All right. Good afternoon, everybody. I am here today with Health Commissioner Dr. DeRaza and Deputy Police Commissioner Cherie Briscoe. 4 weeks ago, we saw that our city was on the up and up in recovery from the coronavirus. Our new case count was down. Our positivity rate was down on a significant decline. However, today, Baltimore's new daily case count is up 115% from 4 weeks ago, with a total of 53,367 cases of confirmed COVID-19 in Baltimore throughout the pandemic. Our positivity rate is at 0.8%, which is a 95% increase from 4 weeks ago. The increase that we are seeing is not unique to Baltimore. Cases of COVID-19 are rising across the state and country, and we know that it's likely that it's been driven by what's known as the Delta variant of COVID-19. But with the rise in cases, we cannot stress enough the importance and urgency of getting the COVID-19 vaccine. Based on Maryland data, we know that in the month of June, that means each and every person that died related to COVID-19 was an unvaccinated individual, and it's becoming increasingly obvious that getting vaccinated is the difference between life and death. Again, every death that occurred during the month of June was from unvaccinated individuals. As we've heard me say many times before, this pandemic is not over, and we must all do our due diligence to protect ourselves and our neighbors and do the right thing to protect ourselves and our neighbors and get the vaccine. So, again, please take the necessary precautions to keep you and your family and those around you safe and get vaccinated. For information on our walk-up sites and vaccine registration, please visit covax.baltimorecity.gov. That's covax.baltimorecity.gov. Dr. DeRaza and I will continue to follow the science and public health and allow data to drive our decision-making as we continue to closely monitor the effects of the Delta variant. While the virus remains unpredictable, we are still close to leaving it behind for good if we do the right and sensible thing. We have all been through a tough time with this COVID-19 pandemic, but as a city, we have navigated and fought through it together, and I could not be prouder of our resilience, patience, and cooperation as a city. Let's continue the fight against COVID-19 together, and let's continue to push everyone we know to get vaccinated. And now I'll turn it over to Dr. DeRaza for remarks. Dr. D.
Good afternoon, and thank you, Mayor Scott, for all that you've done to protect residents here in Baltimore City during this pandemic. I'll begin reviewing the latest case data, as Baltimore City is seeing an increase in some of our key indicators as indicated by our COVID-19 dashboard. As Mayor Scott mentioned, our daily new case count is approximately 16 new cases per day. This is an increase of 115% from 4 weeks ago, with a total of 53,367 confirmed cases to date. Our percent positivity is 0.8%, a 95% increase from 4 weeks ago. The lagging indicators of COVID-19, including our hospitalizations and fatality rate, at this time do remain low. Our intensive care unit and acute care unit capacity remains level at 82 and 90% respectively. 1,103 Baltimore City residents have lost their lives to COVID. At this time, more than 50% of all Baltimore City residents and 62% of adult residents aged 18 and up have received at least one dose of the vaccine. Alongside our clinical partners, we're now operating dozens of vaccination clinics each week, including clinics held during evening and weekend hours. All of this information can be found on our social media, as well as our website, baltimorecity.gov/BeMoreVax, or by calling 443-984-8650. If you are homebound or unable to leave your home, you can also register for vaccination at your home by calling 443-984-2273 or visiting covax.baltimorecity.gov and registering as a homebound resident. Last month, citing low new case numbers and hospitalization rates, we announced that the mask mandates were lifted, removing the last of the pandemic-era restrictions. However, we are beginning to see an increase in new cases and positivity. We believe that this rise in new cases correlates with the rise of the Delta variant, a mutation of the original novel coronavirus that studies indicate may be up to 200% more transmissible than the initial virus. Transmissibility indicates how easily the virus spreads from person to person. Very recently, the Maryland Department of Health reported that 43% of all COVID-19 cases in Maryland were due to the Delta variant. While the Delta variant does not seem to be at this time more deadly than the original strain of the virus, the fact that it's more transmissible poses significant risk, especially for our unvaccinated populations. In June, as Mayor Scott indicated, it was reported that every single COVID-19 death in the state of Maryland was in an unvaccinated person, and 93% of all hospitalizations were of unvaccinated people. The great news is that there currently is available vaccines that are effective at reducing severe disease and hospitalizations related to COVID and caused by the Delta variant. To be clear, the vaccine will not grant 100% immunity, but it will decrease your chances of developing severe illness if you do contract COVID-19. This is not a magic wand, nor is it a protective force field, but having a vaccine is giving yourself and your family the best possible chance to stay safe from COVID-19. The deliberations that many of our unvaccinated populations are having about getting the vaccine will be, for some, a very deeply personal journey. I encourage residents to continue to speak to trusted medical professionals about their concerns and to reach out to family and friends who've been vaccinated to ask them about their experience. But let me be clear, with the rise of cases locally related to the increase in circulation of the Delta variant, if you've been waiting for a sign to reach out to your doctor, this is it. If you still have not been vaccinated, this week, make the steps to reach out to your clinical provider and get answers to any outstanding questions. If you don't have access to a primary care provider, please reach out to our hotline at 443-984-8650 so that we can answer the most frequently asked questions. Our team can also let you know of any clinics happening near you. Continuing to wait puts you at greater risk of getting sick from COVID. There is both a personal and societal benefit to getting vaccinated. These vaccines protect you, your loved ones, as well as those who you interact with more casually, like at the grocery store, while out at a restaurant, or while riding a bus. The importance of getting vaccinated is made even more clear when recognizing that there remain portions of our populations who can't receive the vaccine yet, but can still become very ill with the coronavirus or one of its variants. This includes our children, those under the age of 12 years old who have not yet been eligible to be vaccinated, who are at risk if they are exposed to other unvaccinated people. In order to keep our city operating, it remains imperative that residents are vaccinated as soon as possible. As a reminder, even if you're fully vaccinated, if you're interacting with unvaccinated people or if you're unsure of someone's vaccination status, there's nothing wrong with wearing a mask, especially if you have children at home who can't be vaccinated at this time. I still wear my mask when grocery shopping or in other areas where I feel it necessary to protect myself and my family. Additionally, while it's much harder as a vaccinated person to transmit the disease to others, we still encourage residents who might feel ill to get a COVID-19 test, just to make sure you're not carrying the coronavirus. Every week, the health department continues to provide COVID-19 tests free of charge to residents, and a full schedule can be found at coronavirus.baltimorecity.gov/testing. Let me be very clear. The risk of the Delta variant poses as a transmissible variant of the coronavirus is much greater in the city and areas with lower vaccination coverage. The health department and our clinical partners continue to bring vaccines directly to local communities. We have a specific focus on communities where the data indicates lower vaccination rates, including the 21223, 21216, 21207, and 21213 zip codes. Our data shows that in some areas of the cities, more than 70% of residents have not yet been vaccinated. We, along with our efforts, are putting tremendous effort into bringing vaccines to those low coverage areas. But standing before you today, I'm worried about the disparate impacts that the Delta variant could have on some parts of the city compared to others. If you're unvaccinated, I implore you, Take the steps to get your questions answered this week before it's too late. Contracting the disease itself is much worse than the temporary side effects of a vaccine that over 300,000 city residents have already received. As has been reported, a common question from people with COVID-19 who are hospitalized ask is whether there is still time to get the vaccine. Please don't wait until you're lying sick in a hospital bed to talk to your doctor about getting the vaccine. COVID-19 and its long-term effects are largely preventable. Get vaccinated today. Thank you.
Thank you, Dr. Terraza. And again, I think the message is very clear. We want everyone to remain healthy, and the best way to make sure that everyone in our city, everyone that we love, everyone that we work with and interact with, is to do the responsible thing and get the vaccine. And this is no longer a discussion about whether we have it and people can access it. It's about making sure that we do the right thing. Get your questions answered, get connected, and get the vaccine. And with that, we'll take a few questions. Mike?
Hello, good afternoon, Mayor.
Hey, sir.
Have you thought about reinstating a mask mandate or other limitations, or even mandating that city employees have proof of vaccination, or anything along those lines?
So, as you know, Mike, for me, everything is driven by the guidance about health from our health commission, our health partners. What I will say to you is that, as I said before, when we lifted the mandates, when and if the time comes from a public health and public safety standpoint that we have to put back things back in place, we will not hesitate to do that. We're hopeful that we don't get to that point, but I will not blink in having to do that to save the lives of Baltimoreans. And as far as our workforce, we are discussing with our workforce and our law department all the options that we have as we talk about our safe rollout of bringing people back to work, and we'll update you guys on that consistently.
And I don't know if this is best for you or Dr. DeRosa, but where are you seeing the hesitation now? What are your outreach efforts at this point? Like, where are you seeing people who say, I don't want it, or why are you learning why they don't want it?
So I'll start and then let Dr. D chime in. I think for us, Mike, for you to hear, it's all over, right? And what the health department and what we have been doing for few weeks, months now at this point, is actually going into using the data to determine where we're going to go with our, not just our vaccine efforts, but with our partners with credible messages and community folks to educate people about the vaccine based on areas in the city that have low vaccination rates. That's what is driving where we're going with those efforts to make sure that we're reaching people not just through the health department, but through folks who we know they have a better relationship and actually have a better trust with. And that's the way that you have to break down those barriers and misunderstandings about the vaccine. Dr. D?
No, I think Mayor Scott covered it. I mean, a few weeks ago, we announced our value ambassadors, right? So we announced ambassadors that are focused on communities that we know are particularly high risk. So young men of color, as an example, but it's also inclusive of our pediatric population, those that have disabilities. So again, finding the trusted messenger within that community or trusted partner within that community to help spread the message, to provide outreach when we're providing vaccination events in a particular community, as well as to answer any questions that people have. So again, we know some people have a clinical provider, and that's a great resource, but others are looking more to their peers to get questions answered. So likewise with our pediatric population, identifying peer value ambassadors, so other young people who've gotten the vaccine who are willing to talk to their peers and counsel.
Alexa?
I do have an off-topic question. 2 years ago, when the commissioner unveiled his crime plan, you were hosting those town halls across the city. You said that the long-term plans, the 5-year plan, is important, yet you also were impatient and wanted to see action now. Could you clarify for us what immediate action is in place now to address the crime?
Thank you for that, Alexa. I think you know that we have a very robust plan with our police department that goes out each and every day, focused mostly on the most violent folks. You know, this year we've arrested more homicide suspects than we have in quite some time. You know that gun arrests in Baltimore City are up today. We're going to continue to do the work that BPD needs to do while BPD is a part of the greater plan. So this is not something that we can spin. The reality is that Baltimore police this year have arrested more people for homicide in Baltimore than they did last year. They've arrested more people with guns than they did last year. We're going to continue to push that work. We're also going to continue to evolve the things that they have to respond to so that we get away from the outdated practices that we've had where we say and we hear from members of the media that they should be focused on violence, but we're actually making them go out to behavioral health instances or making them go out because someone's kid doesn't want to go to school. We're going to take that off their plate to allow them to have a focus on what Baltimoreans want them to be focused on. That's the people committing violence in our city.
The other question I had, I wanted to clarify. I was working with your office to clarify it. During last Thursday's consent decree hearing, a member of the monitoring team had said that BPD is 392 officers short, while we clarified with BPD that the number is 259. It was clarified that that is what the staffing plan calls for versus what the budget allows. My question is, does the city of Baltimore need to fill 359? What is that number? And if so,
the
what
number
is
is what
the city doing?
The number is what BPT told you. And I think, Alexa, again, I think for your station in particular, because it seems that you guys don't understand this, the department has carried hundreds of vacancies for the entirety of my time in City Hall, right? And you know I've been there quite some time. What this is about, and we know that this is not just a Baltimore thing. Across the country, as you know, police departments are struggling to hire people. For us, it's not just about the vacancies are there. It's in their budget for them to hire those people, right? The 250 vacant positions are in the police department's budget. We know that. But it's also about, again, and this is where we should probably have a longer, more in-depth conversation where you talk about how you have to evolve. We know that we're now getting ready to go through police redistricting, right? Because the way that our police districts are and boundary lines and the things and the areas that our police have to cover are the same today as they were in 1959, the year my dad was born. That means that we're not operating in the most efficient and effective way, and we're going to have to do that now once we get the census. Again, when you think about our consent decree require and ordered by me requirement to reevaluate what we're doing in call reduction so that our police are responding to police calls and not to non-police calls. All of those things play a part in how we can make our department a 21st century efficient and effective department and not just thinking about the simplicity of the numbers of how many people. It's about what those people are actually doing. Are we having our police officers do police work that is based in 2021, or we having our police officers do police work and everything else based on things from 30, 40, 50 years ago? That's the conversation that we're going to continue to have, and we're not going to allow it to be simplified into something that doesn't understand the complexity and the deepness of the conversation.
So will the city not be in compliance until it reaches the consent decree's number?
Well, that's your two questions. Well, and that would make three. But I will also say that question is not a question for me. I am not Judge Badar. I'm not the monitoring team. They tell us when we're in compliance. We're going to meet the compliance as we go forward. And you heard Judge Badar talk about how we have to understand and take into account what's happening around the country. So we'll continue to have our conversations with the monitoring team and the judge. And as you know, they've been lauding how the police department has been progressing through the consent decree.
Okay,
Thank you. Anybody else? Thank you.